terms of health? Where are the disparities, and how could we do better in our own backyard? Next, please. And keep going. So, next. So what we have here is the working age adult mortality rates. This is in Wisconsin per 100,000 people. And if you look at the disparities for the country as a whole, the age-specific mortality is about that of Wisconsin. I'm sorry, it's hard to see some of the edges here and to read this. But in Wisconsin, whites have a much lower mortality than, for instance, African Americans, which is on the far right. So you see the top left is white mortality, the bottom red is black mortality, adult age mortality, nearly 3 times as high. This is an enormous disparity. Native Americans follow African Americans here on the bottom right. And so within our own state, a very prosperous state that has access to enormous resources, we see these tremendous disparities. Next, please. And just keep going. So we have population health disparities next. Milwaukee County being the greatest concentration of people living in poverty and the ethnic disparities. And we know that social and economic factors underlie these disparities. Next, please. What we do know also is what we can do about these disparities. We have the science, we have the tools and the technology to make an impact. And this has to do with, first of all, providing universal health care coverage and public health insurance and coverage to make sure that we have conditions for people to live in healthy ways. We need to work on the social and physical environment because we know those have an enormous impact on people's health. We need to encourage, of course, individual healthy behaviors, and many people are living in circumstances where it's difficult to make healthy behavior choices. We can't do much about genetics, but we know that that also has an influence. Next, please. Next. Let's see, is that one not advancing? Okay, maybe we're stuck here on this last one. That's fine. Well, what the final slide was going to show you this same kind of a graphic at the World Health Organization, where we know that universal access to health care, up in the top left, is absolutely essential. Societies, governments cannot move forward without universal health care coverage, and we know that the most efficient way to do this is through a single-payer health insurance plan. We need service delivery reforms where people have access to primary health care services at the community level. We need responsible leadership that can guide this system and ensure adequate resources and public policies to support these efforts. So we have the way, we have a blueprint, and you'll hear from some of the other panelists some of the work that's being done to advance these causes. So thank you.